What defines colic? Colic is defined as frequent, prolonged, and intense crying or fussiness in an otherwise healthy infant. It's often described as crying that lasts for more than 3 hours a day, more than 3 days a week, for more than 3 weeks. This pattern of crying is distinct from normal infant fussiness and may be characterized by high pitched or screaming cries that are often hard to soothe. A more detailed breakdown is excessive crying. The defining feature of colic is prolonged and intense crying, often described as inconsolable. There's no obvious cause. The age that colic usually begins in the first few weeks of life and tends to peak between 4 and 6 weeks, often resolving by 12 weeks. And the symptoms are, besides the crying, the baby with colic may exhibit other symptoms like clenched fists, stiffened legs, arching of the back, or flushed faces. It's not a medical problem, and it's important to remember that colic itself isn't a sign of a medical problem. It's a pattern of crying that is often self-limiting. Colic typically starts in the first few weeks of life, peaking around 4 to 6 weeks, and usually subsides by 3 to 4 months. While it's most common for colic to resolve by this time, some babies may continue to experience it for a longer period. While colic usually resolves on its own by 3 to 4 months, some babies may experience it later. There are rare cases where colic may start later in infancy, which is known as late onset colic. Late onset colic is less common than early onset colic and may have different underlying causes. If your baby develops crying that meets the criteria for colic after 6 weeks of age, it is important to consult a healthcare professional to rule out any underlying medical conditions. So, why did I read this to you? I read this to you to show you the symptoms, the timeline of when colic usually starts. I think in majority of babies it starts in the first few weeks. It can start later. I like to stick to facts, so I'm not going to say that she's completely making it up. We don't know. We're not in that house. Maybe Aurora is having later onset colic. I don't know. But if she is, then she should take her to a doctor and maybe not set up a camera, then make sure she's in the frame, walk back, and do a video for TikTok. Maybe she should just focus on her daughter, the one that she said that she wasn't going to use for content. Thanks for coming to my TED Talk and have a great day.